Hi, I'm Nathan Young, physical therapist with Yada Yada. Do you have pain with running, jumping, or sports? Are you at risk for tearing your ACL? Are you unable to do the things that you want to do? Then this video will help you with advanced strengthening of your knee. Oftentimes when we're doing activities, our knee comes into an increased angle, which we call the valgus, and that puts us at risk for knee pain or something more serious where you could possibly tear your ACL and be out for a long time. And so after you have a base for knee strengthening, you want to start advanced strengthening exercises that will help you to meet your goals without pain and limitation. Today we're going to show you my top 4 advanced knee strengthening exercises. Today we have Annalie as our patient, and we're going to show you the top 4 advanced hip strengthening exercises. The first one that we have is a clamshell plank. So Annalie, if you can come up on your elbows, keeping your knee there, bring your hips forward. We want to make sure we have a good alignment of your hip and trunk. That looks good. Now during 30 seconds, I'm going to have you lift this knee up. You're going to hold 2, 3, 4, 5, and then down, and then come up. You're going to hold 2, 3, 4, 5, and then down one more time. Lift up, 2, 3, 4, 5, and then down. Go ahead and relax. So we're going to have you hold 30-second plank. You'll do those clamshells with 5-second holds for that 30-second plank, repeated reps, and you'll do 4 reps 3 times a week. The second exercise we're going to show you today is a single leg bridge, which is one of my favorite exercises, getting all your glute muscles, your core muscles, and your hamstrings. So Annalie, if you can go ahead and lift up on your hips, lift them up, keep a good alignment here, straighten one leg out, and you're going to hold 5 seconds with that. We want to keep your hips in a line and your knee on a line. 3, 2, 1, and then down, and then come up on the other side. So we're working both sides. Keep that knee there. 2, 3, 4, 5, and switch. And then you'll come up. 2, 3, 4, 5, switch. 2, 3, 4, 5, good, and relax. Now with this exercise, we're going to have you hold 5 seconds, do 20 reps. It's more important to keep the form, and so if your hip starts to drop or your leg starts to drop, I'd rest, and then we can build up to where we can do 20 reps with a good technique. The third exercise we're going to do is hip abduction walk, and so we put a band around Annalie's ankles here. We're going to have you squat slightly down with a little bit of knees, bend in your knees, and then you're going to step sideways. So if we can take 2 steps to your left, good technique, stretch all the way out, come back, and then you'll do the same thing. Good upright posture. Okay, second time, let's go a little bit lower, squat down, stretch out a little bigger step. Good, and then come back. Good. So with this exercise, we're going to have you do 3 sets of 10 with what spacing you have. You want to make sure you have a good squat technique. We're working the hips, good upright posture when we're stepping sideways. The fourth exercise we're going to do today is a single leg squat. We're working on strengthening your quads, your hamstrings, and your hip with keeping a good technique. So Annalie, if you can go ahead and stand on your right leg, and you're going to squat down with your arms out in front of you, a good technique where you can. You can tap your foot and then kind of come back up in a good posture, squat down. And each time don't just come up, but don't touch your left foot. And then just down where you can, and then come up. We really want to make sure that we're not having your knee go inwards, because we want to keep that technique while we're strengthening it. So let's try that a couple more times. Up nice and tall, squat down, don't let that knee go in. And hold a couple seconds longer, 1, 2, and then come up and go down. Good. So when we're performing that exercise, we want to do it on both sides. We'll do 3 sets of 10 with a couple second hold 3 times a week. Hopefully you found those exercises helpful today. When performing these exercises, remember to do both sides. You should have mild discomfort. If you have sharp pain, stop. You want to be challenging and making sure that You can progress this distance you're stepping, how high you're lifting your leg, or how far you're squatting down. Hopefully those exercises were helpful and can get you back on track for the activities you want to do. Thank you.